about to start ready, no to come on? In the last video, there were many questions concerning the checkup and how does the process work. So before we tackle the other parts that are a little complicated, we'll go through the basic stuff first. What happens when a patient walks into the clinic? So usually when a patient just walks into the clinic, we have this trade technique in where we assess the patient. So when the patient walks into the clinic, usually you can tell by their walk, how they move, if there's any physical disabilities with them. So you can tell if a patient is limping. Of course, you can assess that there's something wrong with the foot. Same as well with normal conversation. Like for instance, when the patient comes in, you start talking to them. Oh, hello, good morning, like this, and then of course they'll into normal conversation. In this way, you can easily assess if there's anything wrong with their anterior teeth because they're talking, and sometimes you can even see their posterior teeth. So that way, it's also another form of like OD or oral diagnostics. In this conversation, usually you can see if the patient has limitations in their mental capacity, and if they have any speech defects like slurs, and this can help you further assess the patient. So after this, of course, you will receive the chief complaint. So by doing this chief complaint, we take a dental history where we ask how long has the pain been there, when did it start, is it chronic, is it acute, and if also the pain is radiating or is it pulsating, things like this. And then we can also ask for previous dental visits, like when was the last time they visited the dentist, have they experienced extractions before or any dental fillings. And after this, we take a medical history. Usually this is used as like our shield. This is how we protect ourselves from any lawsuits, by carefully taking care of the dental history, but its main purpose is as a shield and also as a tool to help us further diagnose the patient. This way we can understand if there's any underlying diseases like diabetes which may hinder like the healing after extraction. We can also assess if there's any special care or treatment that we need to undergo or any procedure that needs to be done and paid special attention to because of the patient's underlying disease. Sometimes patients tend to lie about their diseases. For instance, they don't want to admit that they have a certain disease, or sometimes they're just completely ignorant of it. They just take certain medications, and that is another way in which we can find out if a patient has a disease. We can find out by asking them what kind of medications to take, and we can understand if they're taking an antihypertensive drug, that they're hypertensive, they have a high blood pressure, or if there's any anticonvulsants or whatever drugs. And this way we can further assess the patient's physical and bodily health. And after that, we usually have them sign that everything said is true, and then after that we go through our regular procedure, which is like oral diagnostics, checking the teeth if there's anything in there, checking the oral cavity. We check for checking the x-rays. All depends on the case as well. If it's just cleaning, then we just take a simple oral diagnostics and then clean. If it's an extraction or restoration, we take an x-ray. And we also look for like other signs and symptoms, and then I'll further look into it later after I get to work. So I'm driving, so I'll talk to you guys later. Here we have Doc Neda, our assistant, and Tita. Hi, Tita. So we will just arrange the chairs and prepare for the day. I'll talk to you guys after we're done. So we're done, we're ready to go outside, and then I'll go visit some friends that will help us explain your questions, and I'll also visit my other clinic where we have a patient waiting for us. Okay, let's go. So guys, we're here at local university where my friend works as a professor, and hopefully he can help us answer questions concerning oral diagnosis and how dentists do things. So let's go. Hey, Dr. Memo!
Yeah,
How are you?
honestly.
So, I have some questions for you.
Yeah.
So in my last videos in YouTube, my friends on the YouTube were commenting
Yeah.
about how do dentists do checkups, and I want to ask you, because you're a professor,
Yeah.
how do dentists do like oral diagnosis? What do they look for? What do they want to see? Like, what are signs and symptoms? Can you tell me what are signs and symptoms?
Oh, alright. So we're gonna talk first of all about the sign and symptoms. Okay. The sign, what the doctor will see in the patient's mouth, and we're gonna like put it in the list, and this will be kind of the diagnosis. And about the symptoms, we can call it a chief complaint.
Chief complaint.
Yeah, this is what the patient will present.
So a sign is what the doctor sees,
Yeah,
and the symptom is what the patient presents.
Yeah, presents.
So sometimes we hear about cardinal manifestations. What are the cardinal manifestations?
The cardinal manifestation, it's a major like symptoms or sign, okay, for the clinic diagnosis. And there is like 5 cardinal manifestation.
Okay.
There is a rubor,
Rubor.
okay, yeah, rubor, or there is a color, or there is a tumor also, and dolor and loss of function.
Okay.
So we're gonna talk about each of like one by one.
Okay.
So the rubor, like sometimes it's gonna be a redness.
Redness, okay.
Yeah, it's gonna be like a gingivitis.
Also, when you see the gingivitis, when something's
when you
wrong.
see it, yeah, it's wrong. So the redness, we can call it gingivitis also. So the color will be a head or a fever.
Okay.
Yeah, and sometimes there is an infection in the patient's mouth. And there is the tumor also, it's swelling.
Okay.
Like we can call it also for the gingivitis.
Okay.
And then there is, but for the tumor, if it's small, we can call it abscess sometimes. Okay. And we should take an X-ray for that.
Okay.
And the donor, it's a pain. And the loss of function, there is a problem with the TMJ.
Okay. So sometimes we hear about what's a primary lesion or a secondary lesion. Can you explain to us about this?
The primary, I'm gonna like give you an example. Okay. The primary lesion, like the chicken pox. Okay. And the secondary lesion, it's the scar after the chicken pox.
So when someone has chicken pox and there's like spots all over, that is the primary lesion.
Yes.
And then after he gets healed, the spots disappear, but there are something
the
that's left.
secondary lesion.
It's the scar, the secondary
Yeah,
lesion.
that's
Okay.
lesion.
Thank you for helping me answer the questions.
Thank you so much. Come again. Huh?
So if people want to follow you, where can they follow you?
I'm so busy, sorry.
Okay.
Just come to my clinic.
Alright. If you want to come to the
Thank you.
clinic, come here too. I see you at Western University.
Thank you so much.
So, thank you. So guys, we are here at the local X-ray facility where my friend works, and hopefully she can help us answer some questions concerning X-rays. So let's go. Hi Dia!
Hi,
I'm doing great.
Ang ginagawa mo dito?
I was hoping you can help us answer some questions.
Yeah. Kasi.
So, in my last YouTube videos, there was some questions concerning dental checkup, how it works, and then X-rays. So, what is a dental X-ray and why is it important?
The dental X-ray. These are the images of your teeth that the dentist will evaluate your oral health. And then there are importance of these. It can detect the extent of the caries, oral lesions, tumors, abscess, like that.
So, what does a patient need to get an X-ray?
We should have the dentist order.
What is
We
that?
have here the sample. We should know what to X-ray, what kind of films, what kind of X-rays.
So, what does a patient go through? What is the process?
Come on, I'll show you.
All right, nice.
We'll sit here.
I'll sit
Yeah.
here.
We have here the lead apron. This will protect the patient from the radiation.
Oh, it's heavy.
And we have the things we need to. This device is called the paralleling device. It is for anteriors and we have 4 posteriors. And after that, we will develop our film in our dark room.
Okay, let's see the dark room.
We have here the red light, and we will dip our film in the developer. Then we will rinse it. We will go to the fixer, and then we will rinse it again.
So, can I see some X-ray films that you've taken before?
Yeah, I'll show you. We have here samples of the films. We have here the occlusal radiograph. Here's the bite wing, and here's the posterior.
So thank you very much for answering some of the questions.
Yes,
so,
you're welcome.
So if my
So
friends in
nice.
YouTube want to follow you, how do they follow you?
You can follow me on my Instagram, Adia, I and AAA.
Thank you very much.
Yes, you're welcome.
Over here we have a patient that is willing to undergo oral diagnostics, and then so I'll show you the basic of how it works. So let's go. So first off, we have to examine the soft tissues. We use the means of inspection and palpation generally. So we work with a general exam, and then we check the lips. And under it, we will be checking for the frenum here and for the tension of the tissue. Next, we will be checking the buccal tissue. We'll be looking for the color, if there's any amalgam tattoos or the linea alba. Next, we'll be checking the soft palate and the hard palate. Here in the hard palate, we can see that there is an incisive papilla. We can also see that there are the rugae. And in the soft palate, right down here at the back, and further, you can see the uvula. So, next we can check for the tonsils, if there's any inflammation. And then we can check the tongue. Take out your tongue, please. Pull it, palpitate and look for any abnormalities. We can also check for the floor of the mouth. You have to palpitate it if there's any abnormalities. The next part, C, we can check the periodontium, which includes the gingiva. And then we have the marginal gingiva up here, and then the alveolar mucosa, which is up higher. We can then look at the attached gingiva here, and then here we can check if there's any gingivitis, if there's any gum recession, and if there's any gum pigmentation. We can also check for the periodontal ligament and the alveolar bone and cementum if there are any manifestations in which in this patient there is not any, and if there's any mobility. Next, we check for the teeth. We can check for, we can use palpitation with our hands. We can use percussion with the end of our mouth mirrors by lightly tapping. And we can evaluate the function of the teeth. So that is our basic mouth exam. And hopefully we answer any of your questions concerning dental checkups. Thank you. Hey guys, today we are with a friend that is an expert in prosthodontics, and hopefully he can help us understand the process in which we can get a denture from a dentist. So when a patient comes into your clinic and wants a denture, what do you go through? What's the process?
So first, do the oral diagnosis and profiling the patient.
So we all know about oral diagnosis, but what about the profiling? What do you mean?
So there are three types of profiling of the patient. Class 1, Class 2, Class 3. Class 1, it is a lateral view of the patient. Class 2, it is a concave lateral view of the patient.
Okay.
Class 3 is a convex lateral view of the patient.
So when it comes to oral diagnostics, when you talk about checking the mouth, basically it's the same with a dentist and a patient with dentition. So with a dentalist patient, there is a ridge or there is an absence of teeth. How do you go by it? What is the process in oral diagnosis?
Classification of ridge. There are three types of ridge. Class 1, Class 2, and Class 3.
Okay.
So class 1, this is the example of the dentals. So class 1, it is the ideal retention and stability. And class 2, it is average and good retention and stability. And this is the class 3, less retention and flat ridge.
Okay. What about arch form?
So there are three types of arch form. Class 1, Class 2, and Class 3 again. So the Class 1, it is square.
Okay.
Class 2, it is tapered. And Class 3, it is ovoid.
So people want to get dentures in the first place. What is the reason?
So these are the main reasons. First, mastication,
Mhm.
aesthetics, restore smile, and phonetics.
Okay, so after you've done all diagnostics of the patient, what is next in order to get a denture?
So first, we take the impression of the patient.
Okay.
Second, pour the cast.
Okay.
And third, take the bite box for the registration of the bite.
Okay.
And last, deliver it to the laboratory.
Okay, so they will do it in the laboratory after and send it back.
Yeah.
So guys, if you want to follow my, how do they follow you?
So please follow me at Isaiah Ramos in Instagram.
Okay, thank you.
Welcome.
So guys, that concludes our video. Hopefully you enjoyed it and you learned something from our video. If you want to follow us for more content, please like and subscribe, and we'll see you next time. Bye!